I am the president and founder of Impact Health Vietnam, which is a US-based nonprofit organization that we founded in September 2012. And immediately a month after the nonprofit was founded, my colleagues and I started to organize the mission for Kiên Giang 2013. And so 2013 we decided we should bring another cardiac team back to Kiên Giang and to continue to help them.
Tới gần tới chất độ luôn mà.
Sợ là mấy đứa nó không biết nó ráng nó chất một xe thôi rồi.
This hospital is the highest level of multi-specialty hospital of the province. The reason why we choose this site to do our mission was in 2011, Thủy, my co-worker, and I had the opportunity to come here and do the first cardiac mission for this hospital. Just the outpatient volume alone, they see over 3,000 patients a day in all the areas of care. And this is a 1,300 bed hospital, but in any given time, they have about 1,500 or more patients. So you know that the condition in each patient's room is very crowded. And the fact that the system is totally based on family care for the patient. The staff is so short, so the family members live and eat with the patient on a daily basis, and you could see that they are in the patient ward, outside of the patient ward, in very, just a roof over their heads. hospital does have a charity kitchen that they set up a few years ago, and they provide free meals for poor patients who can not afford, to buy their food every day, and for the patient themselves. During the first week of the mission from September 30th through October 4th, we have the privilege of having one of the renowned cardiac surgeons from the University Medical Center, Dr. Kenneth Liao. He's an adult cardiac surgeon. So for all the 4 days that he's here, we were able to perform 5 adult cases. 3 of them are congenital heart and 2 are valve. Among those 5 patients that Dr. Liao had operated on, we had a very unique case where we have a female patient, 57 years of age. She's been sick for the past 20 years. She knew she's very sick, but because of the lack of money, she's not able to seek help from the doctors, and she's very afraid that the surgery would kill her more than would help her, become a healthier person. And just 3 or 4 months ago, doctors from the local hospital told her that we would be coming and that we would bring foreign doctors who are expert in the field, and that she should seek help and she should be a candidate for this program. And she did sign up. And for her surgery, in one surgery, Dr. Liao, together with the local surgeons, had performed 3 different procedures. One is to replace her very badly damaged aortic valve. The other is to fix her mitral valve. And then the third procedure is to do a coronary bypass. All 3 in a 5-hour surgical operation. And she has been recovering really well. She's so thankful that she's still alive after the surgery. Her children, her family are very happy for her, and I visited her yesterday, and she's looking forward to being discharged from the hospital on Monday. Impacts her family in every way. We had the opportunity last week to come and visit her home and talk to her husband and her children.
Bởi vì không muốn làm phiền người khác. Tết chịu không nổi, từ hồi Tết là đi liên tục.
So for many years, her illness is not any better. It's getting worse. But because they don't want to be a burden for anyone, they want to bother anyone, so she just keep enduring the suffering, and until about the Vietnamese New Year, which is the beginning of this year, when it's getting worse and worse and worse, and there's no way that she could ignore it. So they finally
sợ con cái lo mình có đủ ăn hay đủ sống đủ ăn.
Nếu mà mình để gói nhớ thì mình cũng sống được. Làm thế cái khác rất khó.
So they just have to live within their means and don't want to bother anyone, but to the point where, because of her illness, it's getting progressively worse. It becomes, impossible to ignore it. So that's when and the children just make enough to, to care for their own family, and they can help a little bit, but not to the point where they can fully subsidize all the costs that she has to take to, to seek help from the doctors.
Con thấy khỏe, con thấy mừng lắm.
But she's very happy to see her mom
Ở nhà ai cũng mừng hết trơn.
recovering well.
Dạ,
So
hôm
far.
qua bạn bè cũng điện lại chia vui dùm là sợ lắm, tại vì cái ca mổ mẹ cũng biết khó, mình cứ chạy vậy hoài, anh em người ta giúp đỡ mình nhiều lần lắm. Người ta cũng thương rồi chia sẻ nhau công việc, đang không nghỉ ở nhà, đang đi theo mẹ. Rồi ai cũng điện chia mừng hết trơn á.
So the news has spread around. So family and friends have been calling to check up on her recovery and to see how she's doing at the hospital, and they are very, very happy for her.
Chịu là mất thôi chứ không nghĩ là trễ.
Ráng chịu chứ còn không có hy vọng.
The family is very, very grateful, knowing that Impact Health Vietnam is going to help her, recover from her illness, and that it is just like a second chance for life, and you cannot even have it in your dream. In your dream, you don't even see this opportunity, but it's so real now, and we truly
Gia
grateful.
đình con cũng không có cái gì để cảm ơn, con chỉ nói cảm ơn thôi, con cảm ơn bác sĩ.
We have to
Cảm
say
ơn
a
tất
lot
cả
of
bác sĩ,
things.
bác sĩ,
We only
cảm ơn bác
say
sĩ nước ngoài, bác sĩ bên Việt Nam.
we truly appreciate and so grateful for the doctors from overseas and also the doctors at King Yak Hospital for providing my mom the opportunity to, get a second chance for her life.
Well, my name is Ting Chuang. I go by Ting. I work at Sarasota Hospital in Minnesota for about over 24 years now. I'm a cardiac nurse. I work in CCU, and my work is empower me to know more about cardiac. But I'm also a co-founder and board directors of Impact Health Vietnam. I came to U.S. when I was about 17 years old, and at the time, I felt so blessed to be in this country, have so much to share, and being a nurse is giving me an opportunity to serve our community in Minnesota, but also abroad. Have founded the Impact Health Vietnam and also partnership with Fairview System. This year, we embarked the first mission, cardiac mission. We're able to. There are 24 team members count this year. We have 81 interventions for our angiogram with or without interventions. We got many donations and individual donation sponsored for the products, and we have worked over $270,000 worth of donations. And Fairview, where I work, have been very generous and kind. You see, you can come in and you can do a ton of heart surgery. You do not make a difference. You might save some life, but you don't make a big impact for the nurses and the staff. The only thing that can be successful for them is you take them to another level of care. You need to teach them and show them how to do it safely. There is many ways doing things, and there are many ways they do it. It's not so much wrong. It's more like it's a better way to do it. I mean, they have done this in their way, and I think in their situation, they possibly have to do what they have to do, and they do well at where they at. But it could be better. It's a simple technique of infection awareness, control, washing hands, those kind of things we need to impress on them. Compassion we show to the patient is important. Communication is important. So many things. Not only we show them the knowledge, but we also show them how we do it in the U.S. A lot of times it be a role model to them. It's like they witness what you see. It's kind of helping them to understand this is important. I think a lot of time nurses love to learn and love to understand, and the nurses here, their level of knowledge is, even they go to 4-year program, their level of knowledge about clinical knowledge is very minimal. They will be directed by physician who actually lack of knowledge himself too, because it's overwhelming expectation for him to do more, but he have a limited knowledge. I found intensivist here is equivalent to ICU nurse in the U.S. They do not have protocol to go by. They do not have a systematic way of treating patient. So oftentimes every individual physician treating patient differently, and the outcome will be different. They can be by their experience, their own how they learned before and how they experience, but they don't have a system in place to collaborate with other physicians or other colleagues to seeking for a better treatment for in order to have a better outcome.
We would like our current volunteers to be messengers. In the past, these volunteers who have traveled with us are the ones who word of mouth. They talk about the program. They talk about their experience being on a mission team like this, and to work in a hospital like King Yang, where they have limited professional staff, they have limited skills and ability, and yet they have to work with an overwhelming number of patients every day. And their working environment is, compared to what they work in the U.S., is very limited. And so I think that they travel with us and feel blessed and humble, and so lucky that they get to work in an environment where they're very supported by all aspects, of their profession. Here, they see, for themselves the patients that they care every day along with the local staff. They have seen, I've talked to some doctors that travel with us in the past, and they tell us that they have not seen cases like this in their whole entire professional career. They only saw it in textbook. So in a way, it is a two-way exchange of experience for our volunteers, our doctors, our nurses, and also for the local staff. They get the knowledge and the skills and expertise from our team, and yet our team members themselves receive a lot of experience and witness a lot of cases that they otherwise would not be able to see in the United States.
My name is Dr. Michael Manolis. I'm an interventional cardiologist with the University of Minnesota Physicians Heart Group. And I am part of this mission. I have been impressed the more I've worked with Yin and with Keen, their commitment, their love and devotion to these gentle, beautiful Vietnamese people. And so it's been a real pleasure to watch the effects of their love for the people come out and be spread this way. So it's great. I really enjoyed those two aspects of it.
Can say that it's a very successful mission, and I'm so proud of all of my team members, and that we hope that they will continue to come with us for many more missions.
Không cô đơn nhờ anh gian anh rồi quên cho tôi với nhiều cay đắng lâu nay, cay đắng trong tay xưa tôi đâu hay, lời ai ân với đời chỉ là cơn gió heo mây. Tôi không cô đơn, tự tôi hay tôi biết yêu cho vui lời ngôn ngữ trên môi, nên anh xa tôi bên ai chung đôi, lời hứa anh quên rồi. chẳng ra gì, thêm gầy hao tuổi xuân thì tôi không cô đơn mà cô đơn chi nữa. Trăm phong thư anh còn thơm dấu con tem, nay mang thư anh cho trắng khuya xem, rồi đốt bên bên thềm nghe mình không còn cô đơn. Tôi không cô đơn, tự tôi hay tôi biết. Anh yêu cho vui, lời ngôn ngữ trên môi, nên anh xa tôi, bên ai chung đôi. Lời hứa anh quên rồi, ân tình ví tựa bèo trôi. Cô đơn mà chi, cô đơn làm gì khi người yêu bỏ ra đi, không lời han hỏi phân kỳ. Cô đơn mà chi, cô đơn được gì khi tình nhân chẳng ra gì, thêm gầy hao tuổi xuân thì tôi không cô đơn mà cô đơn chi nữa.
Đi mưa sớm